Always a leader, London was one of the first communities in Ontario to have a comprehensive vision for the future of healthcare. The story of the North Tower began in the mid-1990s when the Provincial Health Services Restructuring Commission recommended LHSC take primary responsibility for specialized acute care in London and southwestern Ontario. The redevelopment plan called for large-scale changes, including the closing of the aging South Street site, new emergency and critical care departments at the Victoria and University sites, and construction of a new building on the Victoria campus to house the Children's Hospital and the Grace Donnelly Women's Health Pavilion. That vision has now come to fruition. On October 2, 2010, the first patients were moved into the new North Tower. It was a day of celebration as 60 patients arrived to a floor specially constructed for surgical patients. On December 12, 2010, 51 patients were welcomed to the new Children's Hospital on the 6th floor, a floor designed for the unique care needs of pediatric inpatients and their families. This past April, the adult mental health care program moved to the North Tower. This move represented the last inpatients to move out of the South Street Hospital and provided them with new spaces that provide a therapeutic, healing environment. On May 31st, the first baby was born in the newly opened North Tower. Born just before 1 a.m., baby girl Rowan weighed in at 7 pounds 13 ounces. In one of the most significant milestones, the transfer of perinatal, NICU, and many women's ambulatory services took place from St. Joseph's Healthcare London to London Health Sciences Centre. Our organizations worked together for years to prepare for this move, and we warmly welcome the St. Joseph's women's and children's staff and physicians. Finally, on August 15, 2011, the last move, the Medical Day Unit, was completed, making the North Tower fully occupied.